Today's date is June 6th. We're here with Don. And Don, I just asked you how you are today, and what's your response?
Well, after 6 months, I've had the best 2 weeks in ages. I've slept well at night, and my hip doesn't bother me that much, except after I've been sitting for a while. And apart from occasional flare-up, I'm doing much better. Thank you.
You came to me for what reason?
Because of arthritic hip.
Which one?
Right hip.
And what's happened to it since?
It's loosened up dramatically with physical therapy and the shots, and the pain has migrated more to my lower back and to my knee, and so now we're giving shots to my knee as well.
Okay, on a scale of 10,
Yes.
if you came here with 10 points of hip pain,
Yes.
and 0 is no hip pain,
Mm-hmm.
what do you give me after this time?
In my best moments, I'm like a 2 or a 3, and it flares up to maybe a 6 when it's bad.
Okay, and what were you faced with before you came to see me?
Hip replacement. That was, in fact, I've gotten 2 or 3 calls from the orthopedic surgeon who I first went to, asking me when I was coming in for my knee surgery and how I was thinking about my hip surgery. So
What did you say?
I've said, well, I'll get back to you sometime.
He doesn't know, I take it.
I told him, but he said, fine, good, keep doing it. That's about it.
Okay, and how many sessions have you had for your hip?
I maybe, I don't know, a dozen probably.
Okay,
Like
does it hurt?
does it hurt? The session?
The session, yes.
No, the session doesn't hurt, but when I have the hyaluronic acid along with the ozone, I usually have a pretty rotten night the first night.
Okay, but the Prolozone itself doesn't hurt.
Doesn't hurt at all, and the last time I had both, I was in pain that night. I had trouble sleeping. The next day I woke up and I felt wonderful.
Ah, good. So that little bit of pain you had then was worth it?
It was worth it, and I'm
Okay.
looking forward to the same tonight.
Okay. Now, what about your knee?
My knee, I had arthroscopic surgery like 20 years ago, and my knee started acting up. As I said, the pain and stress migrated from my hip to my knee and my back. And I went in and had an MRI done because it was bothering me. And they noticed the repaired arthroscopic thing and said I had another torn thing that needed surgery. And they said, why does it? I said, why does it need surgery? And they said, because no oxygen ever gets there. So I thought this was an opportunity to visit Dr. Rowan and see what we could do about that.
Okay, what's happened to your knee since?
My knee is feeling much better. It doesn't go out nearly as often, and I'm fortunate. I have a physical therapist who works alongside with this treatment, and he's teaching me a different way to walk, which takes the pressure off it, so it doesn't. I don't lose it anymore. So the combination has just been terrific.
And did you notice results very quickly with the Prolozone therapy?
Oh yeah. As soon as I stood up after the first shot, I knew it was different. Yeah.
On a scale of 10, how much different was it?
Oh, it cut it at least in half.
Immediately.
Immediately.
Okay, for the viewer, I just want to explain that Prolozone is a treatment where we first put a little bit of numbing medicine, preservative-free Procaine, into the joint, and then follow it up with a mixture of oxygen/ozone gas, and put that in right behind it. And you told me previously there's really not much discomfort, if any, with this, correct?
Zero, yeah.
Okay, and in your case, to help it along a little bit, we were giving hyaluronic acid in addition, and that can cause a little bit of inflammation, which you noticed, but it was gone within about 24 hours,
24
as you
hours,
said. Okay, and that adds to the benefit of this. Okay, is there anything else you would like to let the viewer know?
What a difference. Thank you.
It was worth it.
Absolutely.
Okay, may I use this video in any way I like?
Yes, you may.
May I post it on YouTube?
Yes, you may.
Thank you very much, Don.